Good day, everyone. My name is Dr Ezenwosu Lilian, a resident doctor in the Department of Community Medicine. You're welcome to UNTH Health Education Series, and I'm here to talk about malaria. When you talk about malaria in our locality, it is called Oyeba, which most of us know. But what is malaria? It's an acute febrile illness that is caused by a parasite. When you talk about acute febrile illness, it's a sudden occurrence of fever that occurs within a short period of time. Malaria is a life-threatening disease if not detected early, but it can also be prevented. World Health Organization estimated in 2019 that malaria causes about 229 million cases of malaria. And also they estimated that it causes about 11% of maternal mortality. In Nigeria, is a major public health problem. And it accounts for major cases of deaths in Nigeria when compared to other sub-Saharan African countries. Malaria is caused by a parasite, and these parasites are four types. You have the Plasmodium falciparum, you have the Plasmodium vivax, and you have the Plasmodium malaria and Plasmodium ovale. But Plasmodium falciparum is the commonest cause of malaria in Nigeria and in other African regions. It is estimated that it causes about 99.7% cases of malaria. And these parasites are transmitted into the woman by the bite of an infected female Anopheles mosquito. Mosquito is something we know. Everybody knows about mosquito. We come in contact with mosquito in our everyday life. There are symptoms that when we know that we'll have malaria. This symptom presents 10 to 15 days after the bite of this infected female Anopheles mosquito. And the symptoms can range from mild to even severe symptoms. The mild symptoms are fever, sudden occurrence of being cold, then rigor, that's shivering, muscle ache, nausea, vomiting. But the severe symptoms ranges from seizures, loss of consciousness, and death. All this being said, malaria can still be prevented. And there are things we need to do in order to prevent malaria. What are they? First is removal of stagnant waters where we live and around us. Another one is cutting of bushes in our places where we live, and also in other environments in our workplace, wherever we have contact with, we need to cut the bushes around us. We also need to sleep under insecticide-treated nets. The last but not the least is indoor residual spraying. And this just means spraying of insecticide once a year or twice a year in order to kill the mosquitoes in our environment. How can malaria be treated? It can be treated by use of artemisinin-based combination therapy. But before you treat, you need to do a test. And that test is being done to detect the malaria parasite by using a rapid diagnosis test, a blood film test. Having said all those symptoms, once you have those symptoms, you need to go to the hospital for your treatment. In conclusion, malaria can be prevented and can be treated if detected early. For any questions or clarification, there's a number on the screen. Give us a call or visit any nearest health facility for further management. Thank you. I'm Ezenwosu Lilian. Remain blessed.